A big part of heart health comes down to knowing your risks. And one risk factor that more and more people are learning about is lipoprotein A, which is an inherited type of cholesterol that is stickier than LDL and has been linked to an increased risk of heart disease and stroke. Unlike traditional cholesterol markers, lipoprotein A levels are largely determined by genetics, meaning that they don't fluctuate very much with diet or lifestyle. Hi, I'm Valerie, a wellness nurse. I believe that no matter your age or current health status, that you have the power to take charge of your well-being and live a longer, healthier life. My goal is to share with you the knowledge and tools that will empower you to make that happen. March 24th is Lipoprotein A Awareness Day, so I wanted to take this chance to shine some light on this lesser known but still important piece of the cardiovascular puzzle. I've already shared my own journey with elevated lipoprotein A and have other videos diving into this topic. I have gotten a lot of comments on those videos from people who also have elevated lipoprotein A, and many of those comments express alarm. So today, I want to take a step back and put this risk factor into better perspective. It is good to know your lipoprotein A level, but it is just one piece of the puzzle. If you find out that you have elevated lipoprotein A, it is easy to become hyper-focused on that one number. But the truth is, while lipoprotein A can increase risk, it is far from the only factor that determines your heart health. There are many other risk factors that you do have control over, and that is where your focus should be. I do love seeing that heart organizations around the world are working to increase awareness of lipoprotein A and even designating a day for this. Despite working in cardiology for several years, I had little awareness of lipoprotein A until I was recruited into a study for it and found out that my own was elevated. Raising awareness is important because despite it being a major risk factor for cardiovascular disease, it is not something that is routinely tested for. Around 20 to 25% of the global population has elevated levels, yet many people have never heard of it, let alone have been tested. Because lipoprotein A is genetic, it is something that you really only need to be tested for once in your life, and it can provide valuable insight into your overall heart disease risk. But what you do with that information is what really matters. Lipoprotein A is measured with a simple blood test, but unlike cholesterol and triglycerides, it's not part of routine screening. Most people have never had it checked unless they specifically asked for it or had a doctor familiar with its importance. If you want to know your lipoprotein A levels, you'll need to request the test. It won't show up on a standard lipid panel. There are two different ways that the test can be measured. One method measures the total mass of lipoprotein A in milligrams per deciliter. This includes all of the components of the lipoprotein A particles combined. The other method measures the number of lipoprotein A particles in nanomoles per liter, which counts how many individual lipoprotein A particles are present in the blood. Because lipoprotein A particles can come in different sizes, these two measurements don't always match up. Many experts believe that measuring lipoprotein A particles in nanomoles per liter is a better way to assess risk. But most research has been done using mass or milligrams per deciliter. It is also important to note that there isn't a definitive answer as to which method is better across the board. Additionally, different laboratories have different reference normal value ranges. Generally, normal is considered to be less than 30 milligrams per deciliter or less than 75 nanometers per liter. Ultimately, the key is to work closely with a healthcare provider who understands the differences and can put your lipoprotein A level into context alongside your other cardiovascular risk factors. The frustrating reality is that there is currently no proven ways to significantly lower lipoprotein A levels. While certain supplements and therapies have been suggested, the research is still ongoing. Right now, the most promising treatments are still in clinical trials. I do have a video on my channel that talks about the most promising trials going on now, so look for a link to that in the description for this video. But just because there is currently no direct way to lower lipoprotein A doesn't mean that there is nothing that you can do. This is where focusing on what you can control becomes so important. It is easy to fixate on a single risk factor, but the reality is many people with high lipoprotein A never develop heart disease, while many with normal levels still do. Why is this? Because lipoprotein A is only one of the many factors that contribute to cardiovascular disease. In fact, lifestyle-related risk factors like sedentary lifestyle, excess weight, poor metabolic health, chronic stress, and an inflammatory diet can increase heart disease risk just as much, if not more, than lipoprotein A alone. When I found out that my lipoprotein A was elevated, I actually took comfort in knowing that I had already taken action to improve the risk factors that I could control. I had already made dietary changes, prioritized exercise, and managed my stress levels, which meant that I was doing everything possible to lower my overall risk. This is why, instead of hyper-focusing on lipoprotein A, the best thing that you can do is zoom out and look at the bigger picture of heart health. If you do have high lipoprotein A, it doesn't mean that you are doomed. It just means that you should be more vigilant in managing the other areas of your cardiovascular health. Keeping LDL cholesterol and blood pressure in check is critical. Even if your lipoprotein A is elevated, lowering your LDL cholesterol through diet, exercise, and if necessary, medications can help to offset the risk. The same goes for blood pressure. Keeping it within a healthy range reduces strain on the arteries and lowers overall cardiovascular risk. It is also important to stay on top of regular checkups and screenings. Talk to your doctor about whether additional testing might be appropriate for you. Because lipoprotein A is linked to increased heart disease risk, you might want to explore additional testing beyond standard cholesterol panels. A calcium score test is a common tool used to assess plaque buildup in the arteries, but it has its limitations as it only measures calcified plaque, not the soft plaque that can be just as dangerous. Look in my heart health playlist for a video that talks about the calcium score test. I will also put a link to that video in the description for this one. Other imaging tests, namely a carotid intima media thickness test, or CT angiography, can provide more insight into early plaque formation. I will have videos coming out on these very soon, so subscribe to my channel and hit that notification bell so that you are notified when they come out. Additionally, an echocardiogram can check for signs of aortic stenosis, another condition that is linked to high lipoprotein A levels. Again, I will have a video coming out about that in the near future. Knowing your lipoprotein A level is valuable, but it is not the end-all, be-all of heart health. It is just one piece of the puzzle, and the real power lies in what you do with that knowledge. If your lipoprotein A is high, do not panic, but do take action. Focus on the lifestyle factors that you can control. Work with your doctor to set goals for your LDL cholesterol and blood pressure, and stay informed about new research and treatment options. And if your lipoprotein A is normal, that does not mean that you are in the clear. Maintaining good heart health is a lifelong process. No matter your lipoprotein A level, the best approach is to prioritize overall heart-healthy habits and stay proactive. Have you been tested for lipoprotein A, and what steps are you taking to improve your heart health? Please let me know in the comments. And if you found this video helpful, please like and subscribe for more content on heart health, longevity, and evidence-based wellness. Thank you so much for watching, and as always, please take good care of yourself.